Hello, everybody. My name is Gina Ditta-Donahue with Blue Willow Precision Medicine, and today we are going to take a very quick look at hormones and the heart. So the heart has many different cell types, each with hormone receptors that are responsive to incremental changes in the endocrine system. In fact, the cellular physiology of cardiac cells is governed minute by minute by hormonal regulation of second messengers and membrane ion channels. The organs involved in regulating the cardiovascular system are all of our endocrine or hormone secreting organs. So we have the thyroid gland, the ovaries, the kidneys, the liver, the brain, the adrenal glands, and the testicles. So when we talk about developing a holistic heart health approach, we really have to look at the whole body. So assessing hormone balance, understanding stress management techniques, weight management, modifying your genetic risk factors, managing inflammation, managing oxidative stress, and managing cholesterol are all important in order to maintain a healthy heart. So this is just a list of some of the heart-related hormones. Some of these are hormones that are regulating the heart at the heart level, and then the heart actually sends out hormones and communicates with the rest of the body. So hormones in the heart is actually a huge topic to cover. So today we're really just going to focus on the activity of sex hormones, insulin, and cortisol, and how these affect the heart. We're also going to take a quick look at how the heart secretes hormones to communicate with the body. So starting with sex hormones, DHEA is a really important marker to understand in both men and women. But we do have studies which demonstrate that among postmenopausal women with coronary risk factors undergoing coronary angiography for suspected MI, heart attack, lower DHEA levels were linked with higher mortality and all-cause mortality. We also know that DHEA naturally decreases with age. So studies show that declining levels of DHEA are associated with increased risk of cardiovascular disease and death in both men and women. DHEA is known to decrease cholesterol. It decreases the fatty formation or the formation of fatty deposits. It promotes weight loss, lowers triglycerides, increases insulin sensitivity, acts as an anti-inflammatory, and helps relax blood vessels. There's a lot of talk out there blaming estrogen for being a problem with heart disease, but it's actually quite the opposite. Bioidentical estrogen actually is protective against heart attack for women. So prior to menopause, women have a significantly lower history of cardiovascular events than men, or a lower incidence of cardiovascular events than men. Postmenopausal, it's the same as men. So that's because women have lost the protective benefits of estrogen. And it's important to remember that we have chemically or surgically induced menopause in women. So no matter what their age, once they have lost that estrogen signaling, their natural estrogen signaling, women have a significantly higher risk of heart disease than men. Estrogen protects the heart against heart attack by preventing inflammation that contributes to plaque buildup in coronary arteries. It also improves endothelial function, which is the function inside your blood vessels. Bioidentical estrogen increases your HDL, decreases your LDL, relaxes and dilates smooth muscle, which is what lines your blood vessels. So this promotes blood flow and would be protective against elevated blood pressure. It acts as an antioxidant by removing free radicals that naturally occur in the blood, and it decreases the accumulation of plaque in the arteries. Synthetic estrogen is not the same as bioidentical estrogen, so it's really important to recognize the distinction there when we're talking about hormone replacement therapy in women. So synthetic estrogen increases your risk of stroke, it increases the risk of heart attack, and it increases the risk of blood clots. Bioidentical progesterone reduces blood pressure, decreases coronary hyperactivity, or that would be like the tendency towards spasticity of the actual heart, improves blood vessel dilation, and regulates the peptides that the heart sends out. So those peptides are the hormones that the heart sends out, and progesterone helps to regulate those. Again, though, synthetic progesterone or progestins are not helpful. So those block the positive effects of estrogen on the heart. They increase your LDL and decrease your HDL. They increase the risk of blood clots, increase the risk of heart attack, and increase the risk of stroke. So again, understanding hormone replacement therapy, synthetic versus bioidentical, is key to safe hormone balancing as we get older, or at any age. Testosterone reduces cardiovascular risk in men. It improves blood flow throughout the heart muscle in both genders. It improves blood sugar levels, decreases insulin resistance, and actually decreases all-cause mortality in men. We have to talk briefly about cortisol. So we know that elevated cortisol has full body negative effects. When we talk just about how cortisol affects the heart, we know that cortisol increases cholesterol, it increases triglycerides, increases blood sugar, increases blood pressure, and can cause changes to the lining of your blood vessels, that's the endothelium, and promote buildup of plaque in the arteries. Insulin is actually another hormone that has a lot of effects on the heart. So the good news about insulin is that it does promote glucose uptake as the main energy source of heart muscle. It improves cardiac efficiency, improves cardiac contraction, improves cardiac relaxation, stimulates the production of new blood vessels, and improves blood flow throughout the heart muscle. So I do see people who often have very low insulin levels. We want insulin to be between 6 and 8. That's optimal. So when we have insulin levels that are dropping like 3, 4, and 5, that can be contributes to significant fatigue. So we want to have insulin at a good level. But the bad and the ugly is that many people have insulin that peaks or goes up much higher than optimal. So elevated insulin levels are associated with metabolic syndrome, insulin resistance, and type 2 diabetes. So it goes from being protective and helping the heart to have energy to damaging heart muscle when it gets to be too high. Insulin can contribute to heart failure. It reduces the heart's ability to pump as it gets to be too high. It's associated with elevated blood pressure, elevated cholesterol and triglycerides, and contributes to cardiovascular disease. It damages the heart muscle, contributes to inflammation, which damages the nerves that control your heart. And then it damages the lining of the heart and contributes to plaque buildup in your blood vessels. Now, as I mentioned before, the heart actually sends out hormones in order to regulate its function and communicate with the rest of the body. So the discovery of the endocrine heart provided a shift from the classical functional paradigm of the heart that regarded this organ solely as a blood pump to one that regards this organ as self-regulating its workload humorally, that means through the blood, and that also influences the function of several other organs that control cardiovascular function. So the heart produces hormones referred to as these natriuretic peptides. These peptides act as messengers throughout the body and regulate kidney function, salt balance, blood pressure, blood volume, heart muscle function, and the stress response. So natriuretic peptides are hormones produced by the heart and the lining of blood vessels to help maintain homeostasis in the cardiovascular system. More is being discovered about how these hormones regulate and affect other body systems, including fat cells, fat burning, energy metabolism, signaling in skeletal muscle, and even insulin sensitivity. So this B-type natriuretic peptide is a neurohormone, so one that is made in the cardiac ventricles, and it is associated with increases in cortisol, norepinephrine, and epinephrine. It increases heart rate and has been associated with increase in insulin resistance, obesity, and high blood pressure. This atrial natriuretic peptide is a hormone secreted by the heart to regulate salt-water balance and blood pressure. It communicates with the kidneys to manage these functions. It decreases blood pressure within the heart, and elevated levels are associated with poor clinical outcomes in patients with stroke, coronary artery disease, and myocardial infarction. Then there's this C-type natriuretic peptide. This is actually a hormone secreted by the lining of the heart and the blood vessels. It helps to regulate vascular or blood vessel homeostasis by controlling local blood flow. And it also helps to manage systemic blood pressure. And studies have shown that it is significantly elevated in people with cardiovascular disease or injury. So we know that the relationship between psychological stress and cardiovascular reactivity has long been suggested as an explanation for the association between psychological stress and cardiovascular disease. So it's known that chronic psychological stressors can lead to increased risk of arteriosclerosis, hypertension, and other metabolic disorders, while acute stressors result in acute increases in blood pressure, heart rate, and decreased metabolic efficiency. So remember, we talked about how BNP can increase cortisol, norepinephrine, and epinephrine. So when we are chronically under psychological stress, our body is sending out additional signals that regulate those same hormones that get upregulated when we're already stressed out. So it kind of becomes just this loop where we're stressed out, so our heart sends out stress signals, and then our heart is sending out stress signals, so we feel stressed out. So you can see how it can become really quite a vicious cycle. So again, understanding that when the heart is under stress, it sends out signals to tell the body that it's under stress, and it tries to adapt to stress. And then when our different organ systems are under stress, they send signals to the heart, which can put stress on the heart. So there's lots of communication happening between our organs, and everybody is just trying to stay regulated and maintain homeostasis. But unfortunately, we can get stuck in a loop that is challenging to break. So how do you know where you're at in this whole process of things? Well, we can do some blood work, and we can take a look at some markers and see what's actually going on in your body. So there are some markers of inflammation that are really helpful. Things like C-reactive protein, high sensitivity, that's what that HS stands for. Then we have myeloperoxidase, that proBNP, insulin, fasting glucose, hemoglobin A1C, looking at your kidney function tests, an advanced lipid profile, homocysteine, ApoB, and omega-3 index. Then it is really important to take a look at genetics. I didn't mention genetics in this talk today. That's a whole nother talk, but understanding what are your genetic predispositions to having inflammation that can contribute to cardiovascular risk. And then, of course, understanding your hormone balance. So what are your hormone levels? Your sex hormones, thyroid hormones, and adrenal hormones. And then really taking a look at your lifestyle. So talking with somebody who can examine with you your diet, your movement, and your stress management. So that was a little introduction to hormones and the heart. Thank you for your attention today, and I hope to help you or see you sometime in the near future.